All right, good afternoon, folks. Thanks for coming to our session here on COVID-19 vaccine and children. We are really looking forward to hearing some of your questions today. I'll give it a moment or two as people join. So if you haven't, I encourage you to visit our website, peterboroughpublichealth.ca, and you can see information. But we did get a number of questions that came in, and I'll be happy to take questions that come in from the audience as we're going through today. And I'll look forward to talking through a little bit on keeping your little ones, your children, healthy as we go through this respiratory virus season and answering questions that you might have. So before we dive into questions, I wanted to go a little bit over on what's happening with regards to COVID-19 and other viruses right now. So if you aren't aware, and we'll put the link in the notes after the session here today, or you can go to the Peterborough Public Health website. But if you either search on the website or Google the COVID-19 and respiratory virus risk index, you can get some information on current transmission. The risk index continues to be updated every Wednesday. And so last Wednesday, October the, that's not the 11th, last week, the risk index went up to moderate, went down to moderate from high risk for COVID-19. And that's because we saw some decreases with some of the outbreaks and the percent positivity of COVID testing. But wastewater signals, which is obviously a means of seeing how much virus is in the wastewater here in Peterborough and surrounding communities, remain very high. So that means that we're still seeing some transmission, but perhaps the increase, the bump we saw in transmission in September and early October has subsided a little bit. We anticipate that will pick back up again as we go through the rest of the winter time, and we anticipate some of the other viruses like influenza and RSV and other viruses that we haven't seen too much of yet will also pick up as the day goes through, the fall goes through. So let's just go through some of the questions that we received, and again, I'll open up and keep an eye on the chat in case there's more questions that come in. So the first question we got is, when should my child get their next COVID-19 vaccine? Many of you may have already had your children protected. Anyone 6 months and older is eligible for the primary series of vaccine, which is 2 or 3 doses depending on the vaccine. And now children 6 months to 4 years of age are eligible to receive an updated dose of the vaccine, the XBB vaccine. Individuals older than 4 are eligible if they've had an underlying health condition or something that makes them more susceptible, medical at risk. The recommendation is that at least 6 months have passed since either the last dose of vaccine, if that's applicable, or the last infection with COVID-19. For many people, you may not know, and if you don't have a confirmed infection, it is okay, it's safe to proceed, but the advice is just related to when it's potentially the best protection. Another question that we got in from the audience was, can my child get the COVID-19 vaccine and flu shot at the same time? So yes, it's safe for children 6 months and older to get both. They can be on the same day or a day or multiple days apart. There's no relationship that restricts when you can get one or the other. Many places, including some of the healthcare providers and pharmacies in the community, are offering both at the same time. I know for my kids, I've been able to book them in for both COVID-19 and flu shot at the same time, so they'll get that protection. And if you have questions, obviously, about that or their protection, we would recommend you either ask the vaccinator when you go to one of the appointments, if you come to our public health clinic or the pharmacy, or you could consult with your healthcare provider, your primary care provider, before going in to get that vaccine. Another question that we got here related to where can you get an infant vaccinated for flu and COVID-19. The person asking the question says, most pharmacies are only offering it for adults in Peterborough, and the closest next date with PPH seems to be in Havelock. Will there be pop-ups in our community soon? So again, you can visit our website to see all of the dates. You can also call 705-743-1000, extension 331, and we're happy to help book you in for an appointment. Last week we had 3 clinics that were available for anyone 6 months of age and older. So our public health clinics are able to offer vaccination for those under 2 that the pharmacies aren't necessarily vaccinating. Our next clinic for PPH at our building here is on October the 27th, so this Friday. And there's going to be a 6-month plus clinic in Cavan Monaghan on Halloween, October 31st, and in Norwood on November the 6th. So our team's working diligently to add more clinics and appointments, and you can keep posted on our website or book online on the provincial government website if you want to find that. So lots of different options, both your healthcare provider, family doctor's office potentially, your pharmacy may, and certainly for those ages where you can't get it at the pharmacy, our public health clinics will be happy to help you out. Okay, next question that we got in was, is the XBB vaccine being administered at our COVID clinics? Is it approved for children? So yes, we've began rollout with the XBB vaccine. It is available for children. At this time, that's the vaccine with the best protection against circulating strains of COVID-19. They're descendants, sublineages of XBB, so it's great protection, and that's important for this upcoming season. The XBB vaccine will update protection in a really important way, and that is even the case for people that have gotten a previous booster dose with one of the bivalent vaccines. This is not a booster vaccine. It's a whole new vaccine that is targeted against XBB, and so it's important protection to get your protection up to date if you're not already protected. So hopefully you can find an appointment and book in to get that dose. Another question we got in from the audience was, is breastfeeding a 6-month-old after getting a booster of flu and COVID-19 vaccine enough, or should you also have your baby directly vaccinated? So that's a question about if you personally are breastfeeding and you get your vaccines, is that good enough protection for your baby, or should you get protected? So we know that breastfeeding is super important for healthy development, and it's safe. It's safe after vaccine. It's in fact very important for getting infants not only good nutrition that they need, but also getting them passive immunity through the breast milk. And so for people that are breastfeeding, getting the flu shot and COVID vaccine while pregnant or breastfeeding helps them develop antibodies you can share through breast milk. However, even still, if you're 6 months or older, the vaccine is better. It's more optimal protection. The amount of antibody transfer you get through breast milk is less. And so while it is helpful protection, and especially for those who aren't eligible for the vaccine because they're less than 6 months of age, it's the best protection that we do have. But if you're over 6 months of age, or you will be this fall before the COVID and influenza vaccine seasons are over, we would recommend getting vaccinated because it provides added better protection for baby and is really important. So hopefully that answers that question. I have questions about my child's medical history and the vaccine, but I don't have a healthcare provider. Who should I contact? Fair question. We know access to primary care providers, healthcare providers is challenging right now. And usually we'd recommend the healthcare provider, if you have a family doctor, be your point of contact if you have questions about their medical history. However, if you don't have a healthcare provider, we have some recommendations for you. One is Health 811, which is the phone number that you can call and speak with a nurse, a healthcare provider that may be able to help answer some of your questions. Sick Kids Hospital, if you search for Sick Kids, does have a COVID-19 vaccine consult service, and you can get in touch and get advice from healthcare providers there. So that's another resource. And Facts Clinic is also another way that you could get further information. So recommend checking some of those out. And also you can always call 743-1000, speak to one of our members of our team. We might be able to help you depending on what the question is. Or if you do book in an appointment, at the beginning of that appointment, most times your pharmacist, your healthcare provider, or one of our staff at Peterborough Public Health are happy to talk through any outstanding questions that you might have. So we're happy to help. And again, all this information is available on our COVID-19 vaccine website, peterboroughpublichealth.ca. Okay, another question that came in is about the RSV vaccine. And so RSV, or respiratory syncytial virus, is a virus that causes respiratory infections. It actually causes nearly as much disease and death, probably, as influenza. Though because it isn't a reportable disease like influenza, we don't have as clear data on it. But it likely causes, similar to influenza, about 3,000 to 5,000 deaths per year in Canada. Some of that infection and hospitalization and even deaths would be in young children, infants. And so for a long time, we've cared a lot about RSV. It used to be that there was no vaccine for RSV, but new this year, we have a vaccine that is approved. It is at this stage only approved for 60-year and older, so for older Canadian populations. And in Ontario, there will be a publicly funded vaccination program targeting the highest risk folks in long-term care and other sort of settings like that with this vaccine. And we'll have to watch as the approvals evolve, because in the US, there are now multiple RSV vaccines that have been approved, and including for young children. And so into the future, we would anticipate that these vaccines might also be available for children in Canada, but unfortunately, we don't have that protection now for children. So if your child is at high risk of RSV, which is largely people that were born prematurely, then their healthcare provider likely would have arranged some preventive treatments that are available. And you would know about this through the neonatal intensive care unit or your family doctor or pediatrician. But for everyone else at this stage, under 60, there isn't a vaccine against RSV. And so some of the other pieces that we know that prevent respiratory viruses more broadly continue to be important. And so that is staying home when you're sick, isolating, trying to spend more time outside, and when you are inside, really ensuring that ventilation is improved. That can be done with your furnace system, turning it up, opening windows, doors, getting fresh air from outside in, and or some of the in-room air cleaning filtration devices. All of that is very helpful to preventing viruses. Masks continue to be effective, and that's something to think about, especially for those who are at higher risk or can't have protection otherwise. And the other vaccines are important too. So even though we don't have an RSV vaccine, COVID and influenza will provide important protection against those viruses and are worth thinking about. So, my goodness, I should have got myself a glass of water. Here I am, we're 15 minutes in. I've addressed all of the questions that came in to us online in advance. And I'm just keeping an eye out. Is there any questions in the chat? I see. Thanks for all the information. No problem. Happy to be here. Happy to help. Any questions from the audience? I'll hang around in no rush and happy to help if there are any. If not, I'll reiterate too, our website's a great source of information. Now's the time to start looking at booking your child, their vaccines, influenza, and COVID-19. And those can be obtained through your healthcare provider, through public health, or through pharmacies in the community. And our website has lots of information on how and where to access. Any other questions at all on the vaccine or anything for respiratory viruses this fall. Happy to help. Well, it's a quiet group listening in today. That's okay. All right, well, we'll keep an eye on social media, and if there are more questions that come in, we can always set up another one of these. We can continue to address them, and hopefully this was helpful, getting you some information that you need for your child or on vaccine and viruses more broadly. And I'll just say thanks to those who were able to join, and hope you have a great rest of your Monday, a great rest of October, a happy Halloween next week, and stay safe. Thank you. Take care.